எனக்கு பழக்கமே கிடையாதுண்ணா.
பரவாயில்ல, நீங்க என்ன பண்ணாலும்
ஒரு
பிரச்சனை.
தப்பா விட்டுட்டேன். எங்க தோசை
அவருக்கு இப்பதான் வரப்போகுது.
போகுது. பழக்கமே கிடையாதுண்ணா.
பரவாயில்ல, நீங்க என்ன பண்ணாலும் பிரச்சனை. இங்க 2 சேர் இருக்கு. என்னப்பா யோசிக்கவே மாட்டீங்க நீங்க. இங்க உட்காருங்கப்பா.
எட்டாது இது.
No sense.
நீ மேல இருக்க நான் கீழே இருக்கேன்ல.
I'll be on this, you be on this. Don't make a mess, please.
ஹலோ. சரி சரி, அதான் என்ன கூட்ட சொல்றான். சரி, ஓகே. நம்ம அப்போ பார்க்ல போட்டு நான் அவனுக்கு அதுக்கு ஒவ்வொரு ட்ரிப்பை டக்கு டக்குன்னு கட் பண்ணி.
Man, you too old for this, dude.
ரெண்டு கொரியர் வந்து இரு. நான் முதல்ல முக்கியமான விஷயம், காரை வந்து பார்க்கிங் ஏரியால போட்டுணும். அபி இடத்துல போட்டு அதுக்கும் சேர்த்து தான் 300 ரூபா பேசிக்கிது.
What immunodeficiencies are characterized by absent scanty lymph nodes and tonsils? This is gonna be a B cell kind of things. It's gonna be
எடுத்துட்டாங்களா இல்லையா?
common variable immunodeficiency and BKT. Sorry.
எதுக்கு?
Yeah, it's gonna be B cell or X-linked agammaglobulinemia. Thank God. Or pulmonary regurgitation.
அவ்வளவுதான். இதுல இருக்குது
chronic granulomatous disease.
யாருக்கிட்ட பர்மிஷன் வாங்கிட்டு ஏதாவது பண்ணாலும் பரவாயில்ல, சும்மா இருக்குதுன்றதுக்கு.
Within 6 months after birth.
ஏன் அவருக்கு செக்யூரிட்டி இது இல்லையா? கமாண்டர் இல்லையா? கண்ட்ரோல்ல போல இருக்கு. இந்த விட தப்பு பண்ணக்கூடாதுல்ல.
Loud S2. Okay. Systolic ejection murmur at left upper sternal border. Okay. Holosystolic murmur at, this is going to be tetralogy of Fallot.
Okay.
Oh no. Systolic ejection murmur at left upper sternal border. Holosystolic murmur here. So it's going to be pulmonary stenosis, VSD. Oh, complete AV septal defect. Most common in Down syndrome. Loud S2 due to pulmonary hypertension. ASD due to increased flow against pulmonary.
நான் சொல்லல. டெய்லி குடுக்குறீங்க. ஜூஸ் வேணுமா நாபி? ஜூஸ் வேணுமா இப்போ?
விடுங்க, எப்பயோ செஞ்சிருந்தா பரவாயில்ல, இப்போ பண்ணி என்ன? அவங்களுக்கு தெரியும் நம்ம எப்பயோ பண்ணி வைக்கணும்ட்டு, எல்லாம் மறந்துடுறாங்க.
ஓகே, போட சொல்றேன். ஓகே, ஜூஸ் டெய்லி போட்டு தான் குடுக்குறீங்க, ஏன் மறந்துட்டீங்களா? இல்லப்பா, இங்க நைட் குடிக்கல இருந்தா வேணாம்.
டெய்லி நைட் தானே குடிக்கிறேன்.
சரி, தோசை இந்த வரட்டும். தட்டு
Don't get this. What is the definitive treatment for severe combined immunodeficiency? That's going to be bone marrow transplant, stem cell transplant, IVIG, steroid isolation. CGD is characterized by recurrent infection, granuloma formation with catalase positive organisms. That's good. Common variable immunodeficiency is associated with low immunoglobulin due to decreased B cells, normal level B cells. Treatment for patient with prolonged QT is beta blocker therapy and pacemaker placement. Okay. Hereditary angioedema may be diagnosed by low C4 levels and confirmed with C1 esterase inhibitor deficiency and dysfunction. I don't know what she's doing here. Please send her away. Lazy lady. Hyper IgE may be remembered with mnemonic ABCDF. Abscess, baby teeth, facies is abnormal. Dermatological abnormalities, eosinophils, fractures. Physiologic gynecomastia may occur in pubertal, elderly, and infants newborn, right? Due to placental transfer of maternal. Please clean your hand and then feed me. You're touching your feet. Clean your hand and then feed me. Not with this hand. Understood? What do you understand? Oh man, I'm bad at these. Right ventricular impulse single.
கரண்ட் இல்லையே போட்டு விட்டுருங்க கரண்ட் கரண்ட் எப்பயே போயிட்டு நீங்க நான் அதுக்குள்ள நீங்க ஊட்டுறதுக்குள்ள நான் போட்டு விட்டுறேன்
நீங்க விடுங்கப்பா.
இல்ல இல்ல ஒண்ணும் இல்ல
அதுக்குள்ள நான் சாப்பிட்டே முடிச்சிருவேன்.
சாப்பிட மாட்டேங்கப்பா அது எவ்வளவு நேரம் ஊத்துறேன் தண்ணி குடிச்சு குடிக்கிற தண்ணி குடிக்கலையே இந்த வாரம் டெய்லி வந்தவங்க குடிச்சு வச்சிருந்தா சேர் எடுத்து போய்டு வெளில எடுத்து போய்டு
Left upper.
வந்து வச்சிரு
Left upper sternal border is the pulmonary area. Systolic ejection motor. The rest is on. This is tetralogy of Fallot for sure.
Okay.
Yeah. Ah. Good. Good. That's good. This is normal for reassurance. This is fine. Catalase positive. Hereditary angioedema. Oh. Without urticaria. It's going to be itraconazole and TMPS. Cervix. What? Atrioventricular septal defect. Pericardial effusion. Cervical cancer, tobacco use. கரண்ட் போயிட்டு it's a AV defect. That's the VSD system. ASD doesn't have a murmur, that just has a flow murmur at pulmonic area. Loud S2 is pulmonary height. Common variable immunodeficiency is due to decreased B cells. Sorry, plasma cells. Tetralogy of Fallot presents with cyanosis. Yeah. What murmur do you get? You get a holosystolic murmur at the left lower sternal border. Boot shape. Cyanosis. It's either that or it's the systolic ejection murmur at the upper left sternal border. So yeah, upper left sternal border. Shows boot-shaped heart. Yeah. Turner syndrome is X and 0, 45 X and 0. Become cyanotic with left axis deviation on ECG, decreased pulmonary marking on CXR. There is holosystolic murmur.
மீனா தோசை வருதாம்மா?
This appears to be tricuspid atresia. Then there's pulmonary stenosis as well. The tricuspid atresia, there's an ASD, it goes to left atrium, then comes to left ventricle. Yeah, by myself. That's all.
சொல்லிட்டேன்.
ரெண்டாவது அது
இது மூணாவது.
அப்ப அதோட போ.
போதுமா? சரி. முட்டை எடுத்து வந்துருமா?
முட்டையா? அதுவும்
ஆமா, வெறும் ஒயிட் மட்டும்தான்.
ஏன் இது அதிசயமா செஞ்சிருக்கீங்க?
பாட்டி தான் பேசுச்சு.
சரி கொடுங்க. சரி கொடுங்க. செய்யலன்னா வேணா.
செஞ்சாச்சு.
All vaccines should be administered according to the chronological age.
கொஞ்சம் குழம்பு போட்டு தானே சாப்பிடு, அப்படியே சாப்பிடு.
அப்படியே சாப்பிடு.
ஸ்பூன் வரணும்.
No B cell maturation. That's CVID. Oh no. Brutin. No maturation. Okay, this is maturation, that's different. Okay. Patient with Turner syndrome have decreased level of estrogen and increased level of FSH and LH. normal level of B cells. Treatment for patient with prolonged QT is beta blocker therapy and pacemaker.
மார்னிங் டாடி வருவாரு.
டாடி சொல்லுவாரு எப்பவுமே.
என்ன சொல்றது?
அம்மா. Grade 2 holosystolic murmur heard over left sternal border with diastolic rumble over cardiac apex. There is also loud P2. So that diastolic rumble is due to increased flow through the mitral valve. Holosystolic murmur over the left sternal border is probably a PST. So this looks like it's a tetralogy of Fallot, but probably not. Yeah. So why is there a loud P2? So loud P2 because of lot of flow through the pulmonary valve, right? Okay. Okay. That's good.
அவ்வளவுதானே, போனோம்ல இந்த வருஷம்.
Hmm. Okay. I'll do this. ஒரு ஸ்பூன் மட்டும் கொடுங்க. Primary amenorrhea is the absence of menarche in girls who are more than 13 without and 15 with. Right. That's good. ஆமா எடுத்துட்டு வரேன். What is the most likely diagnosis? X-linked agammaglobulinemia. Treatment: give prophylactic drugs and IVIG. Okay. IVIG replacement. So replace immunoglobulins. Okay. What is the first line treatment for bulbar lichen sclerosis? I guess you give corticosteroids. High potency topical corticosteroids. Clobetarsol. Provide relief from itching and dyspareunia. Second line topical calcineurin inhibitors. Tacrolimus. Okay. Nice that. Failure to thrive, easy fatigability, grade 2 holosystolic murmur. That means it's a large ventricular septal defect. Diastolic rumble over the cardiac apex. That means a lot of flow through the mitral valve. There's also loud P2, probably due to pulmonary hypertension. So this is a large VSD. That causes L2R shunt. Yes, good. Imperforate hymen presence with hematoculpos and cyclic abdominal pelvic pain. Primary amenorrhea. This accumulation is also known as hematoculpos. Right. Pap testing may be discontinued in patients 65 and 3 consecutive negative pap smear or 3 or 2 consecutive negative co-testing. Okay. So the diagnosis is Bruton's disease and treatment is IVIG. Clobetasol, second line is calcineurin inhibitors such as tacrolimus. It's good. Adolescent girl with amenorrhea cyclic with bulging. This is imperfect hymen. Labor pains despite having her period. Reveals irregularly. So this is a prolapse submucosal leiomyoma or fibroid. Good. Abnormal secondary sexual development. Yes, they do. Have abnormal. No, they have normal. Sorry. Sorry. Decreased pulmonary markings means it's a clear lung usually. Pulmonary undercirculation. Tricuspid effusion. Okay. Anaphylaxis refractory to one dose of IM epinephrine without respiratory failure is managed with you can go up to 3 IM. So you go for IM epinephrine again. If there's edema, stridor, or respiratory failure, you go for intubation. Okay. My egg. Vomited. எல்லாத்தையும் பழி போட்டுருங்க பாட்டிக்கு தான் கரண்ட் போயிட்டு இது போயிட்டு சும்மா சமாளிச்சிருங்க எல்லாத்தையும் 13 with secondary sexual 15 primary ovarian insufficiency will be hypogonadotrophic hypogonadism under circulation it's normal side effect of the drug tamoxifen yeah absolutely you need prophylaxis you need it for 5 years if it's uncomplicated or until he turns 21 if there's carditis but no valve disease you go for 10 years or until he's 21 if there is rheumatic heart disease yes
Going to library.
yes
Okay. Ready for 8 o'clock.
yeah if there's valvular heart disease then 10 years or until he's 40 what congenital heart disease may cause heart failure and shock after PDA closure so this is something that depends on ductus arteriosus heart failure and shock after PDA closure it could be hypoplastic left heart syndrome. It could be truncus arteriosus or coarctation of aorta. So if it's a preductal coarctation, the coarctation happens before the duct. Then you will not have the collaterals develop. Earlier.
So you'll be going to library with lunch. Morning daddy ஊட்டி விடுவாரா தோசை
Yeah.
சரி அப்ப தோசை தான் கஞ்சி கிடையாது
Yeah.
சரி
Right. No B cell maturation. Maturation is Bruton's disease or X-linked ACAM, the same thing. Post-pregnancy dyspareunia is due to elevated prolactin. Post-operative pain without erythema drainage is consistent with normal signs of wound healing. Lichen sclerosis presents as leukoplakia with fibrous, thickened, itchy, parchment, thin vulvar skin. Would you like to sit here with me for some time? Okay. What is this? Infertility with abnormal menses is a decreased ovarian reserve. Okay. Decreased ovarian reserve is definitely. Okay. So this will have abnormal menses. Physiologic gynecomastia may occur in newborn, puberty people are going children going undergoing puberty in males. Heart failure and shock after PDA closure could be severe aortic coarctation of aorta, and it's always a pre-ductal. Coarctation occurs before the ductus arteriosus. So ductus arteriosus gives it a distal. Then if you cut off the lunocollateral, so it's gone. This is going to be clobetasol. Good. Turner syndrome. Good. Parchment like vulvar skin. Good. Agonist at bone and uterus. That's tamoxifen. How are you going to treat coarctation of aorta? I guess you do surgery. What else can you do? What else is the treatment? Surgical decompression. Smaller VSD are often asymptomatic, may close spontaneously. On physical exam, it will present with a high-grade murmur. Tetralogy of Fallot will result in a right to left shunt with early central cyanosis. Thin white flake on vulva suspicious, give clobetasol. Oh, sorry. First you do a punch biopsy to rule out because pre-malignant. Estrogen receptor antagonists at breast and agonists. Hereditary angioedema is diagnosed by and confirmed with C1 esterase inhibitor. Or it's going to be because of the streak ovaries. DASH disease, chronic granulomatous disease. Lactational amenorrhea is due to high which inhibits GnRH production. What is the best treatment? IM epinephrine, 1:1,000. Accumulation of mucus in the vagina or uterus. Menstrual blood, yeah. Have low levels of estrogen, high levels of FSH and LH. Is associated with the bicuspid aortic valve. Pap testing may be discontinued in patients. More than 65 with no history of CIN2 or higher pre-contractive with 2 co-negative. It's 65. Pulmonary artery arising from left ventricle and aorta. That's transposition of the great artery. And the only way that it's going to work is if you have a VSD present, or if you have a VSD present there, or if you have a PDA present. So normal heart aorta is posterior to right pulmonary artery. In transposition of great vessels, aorta forms anteriorly and right of pulmonary artery. So right ventricle have been transposed. Hmm, okay. So you're only going to hear the murmurs of the aorta. What is the most common cardiac complication? Bicuspid valve, aortic stenosis, aortic dissection. Lichen sclerosis. Physiologic gynecomastia may occur elderly males. Excellent. Wow. Okay. I've done 30 more questions. All fresh cards. My goodness. Sorry. To unsuspend it first. Deck. Those are today's cards. 78 extra cards. Okay. We'll get started with this one. I'm gonna struggle again. Dash is characterized by pulmonary artery transposition of the great vessels. Oh, in DTGV, aorta forms anteriorly. In LTGV, right ventricle and left ventricle have also been transposed. Oh, okay. D and L. Okay. So D is bad and L is good. Okay. Adolescent amenorrhea, bulging vaginal mass, imperforate hymen. What is the likely cause of this murmur? So this is a PDA. So continuous machine-like murmur accentuates around S2. What is the effect of hyper-IgM on neutrophil count? Decreased. Did not know that. In infantile form, coarctation of aorta lies infantile form. So assuming the person has survived. So it's going to be preductal before. Okay, between preductal before the patent ductus arteriosus then. Yeah, before preductal. That's good. What is the recommended management of patients with CVID? So CVID is due to impaired differentiation. So I guess you just give them IVIG, replacements and antibiotics. Good. This is detransposition. Larger ventricular septal defects may lead to left ventricular volume overloads, that's eccentric hypertrophy, and consequently heart failure. Yeah. What is the effect of hyper IgM syndrome on neutrophil count? It causes neutropenia. Hyper IgM causes neutropenia. Patients with DASH deficiency, anaphylaxis, IgA deficiency. Where is the continuous murmur due to PDA best heard? It's heard in the first left subclavicular space. That's what I think. Left infraclavicular. Yeah. What class of immunoglobulins are decreased? All. Patient tetralogy of Fallot may respond to cyanotic spells, which decreases systemic vascular knee to chest position, squat. Right. Defective class switching, that's hyper IgM or a CD40 ligand. Yeah. 1 month of biphasic stridor that improves with neck extension but not with prone positioning. Biphasic stridor is always a tracheal ring, which is due to the branched aorta vascular ring. Tracheomalacia would be an inspiratory stridor. Okay. Hyper IgM syndrome will cause neutropenia. That's the type of conversion disorder, psychogenic pseudosyncope. So it's going to be the left infraclavicular space. Beta blockers are used for management of hypertrophic cardiomyopathy and dilated cardiomyopathy. Indicative PDA. Marked leukocytosis with neutrophil predominance. Fever and signs of heart failure, several days of upper respiratory tract. There is going to be viral myocarditis. So signs of heart failure. இந்த வெண்டைக்காய் பத்தாது நேத்து நிறைய சாப்பிட்டேனே
பத்தாலையா?
நான் தான் செஞ்சுட்டு மாட்டேங்க ஏன்பா நேத்து நான் வேஸ்டா பண்ணேன் நான் நேத்து சாப்பிட்ட அமௌண்ட்
300 கிராம் வாங்கிட்டு வந்து 300 தான் சொன்னாங்க, செஞ்சுட்டேன் நேத்து. அந்த வட்டால இருக்கிறத சொல்ல பாத்தீங்களாப்பா, எடுத்துக்கிறேன். இல்ல இல்ல, அது வட்டால வந்தது வந்து உங்களுக்கு எடுத்து தனியா கொடுத்து தம்பிக்கு வருது. அதான் அது அவங்க எடுத்துக்கிட்டு. சரி,
கண்டிப்பா எனக்கு பிடிக்கும்ட்டு சாப்பிடல, வேற ரீசனுக்காக. A postterm neonate with green amniotic fluid during birth. Subsequent respiratory distress, likely as meconium aspiration syndrome, should receive oxygen. Supportive care includes oxygen, ventilation, inhaled nitric oxide, which dilate vasculature. Infertility with abnormal menses. Risk primary ovarian infections. Characterized by decreased neutrophils at infection sites. A cold outbreak. Infantile form of coarctation of aorta is associated with PDA. Preductive form. When does common adolescence? There's DiGeorge syndrome, the catch-22 is a mnemonic. It is cardiac abnormalities. T is lack of thymus. C is cleft palate. H is hypoparathyroidism. T22 is chromosome 22. Forgot what A is. So C is cardiac defects. Yeah, C is cardiac truncus arteriosus, tetralogy of Fallot. Abnormal facies, retronathia, thymic aplasia, hypothyroidism. So meconium aspiration syndrome should receive supportive care, which includes oxygen. Hyper IgM, recurrent ward infections, especially at mucosal sites. Skin infections, I guess. Pyogenic infections. Poor opsonization. Encapsulated bacteria also may have opportunistic infections. Pneumocystis cryptosporidium. Histoplasma. Good night, man. Absent pus formation. Grade 2 systolic ejection murmur that decreases with standing. Grade 2 systolic ejection murmur that decreases with standing. Uh, Decreases when you stand, venous return decreases. So, oh, let's see what this is. Benign murmur. Okay, benign murmurs are early mid-systolic, one or two that decrease in intensity with standing or Valsalva. Okay, I won't forget that. So, C is cleft palate. A is abnormal facies, red. Thymic aplasia. Conotruncal abnormalities. DiGeorge syndrome is associated with truncus arteriosus and tetralogy of Fallot, and this is hypocalcemia. Very good. Best treatment to minimize development of is IM epinephrine 1:1000. Susceptible to aspergillus. Chronic diarrhea, thrush, failure to thrive, the severe combined immunodeficiency. Right. Type 1 hypersensitivity, cross linking of IG on pre-sensitized. Recurrent episodes of pneumonia, diarrhea, 3 years. Is in 30-year-old women with recurrent episodes of pneumonia and diarrhea for past 3 years. So, IgA deficiency. Why is she having common variable immunodeficiency? In adults with recurrent bacteria. Okay. Okay. All other than IgM. Ductal dependent congenital heart diseases require dash until surgery can be performed. Prostaglandins. Name any three ductal dependent left hypoplastic heart syndrome. Severe coarctation of aorta, transposition of great vessels. Leukocyte adhesion deficiency characterized by increased circulating neutrophils. Good. This is conversion disorder. Newborn with cyanosis does not improve with 100% continuous machine-like murmur and auscultation. That's that's okay. So the person has a patent ductus arteriosus, does not improve with oxygen. That means not a lung pathology. Uh, I don't know. PDA allows mixing oxygenated blood. So suppose you have a right to left shunt. So it goes off the aorta. I don't understand though, where are you getting the oxygenated blood from? It's already a right to left shunt. Suppose it's a patent. Suppose it's a tetralogy of Fallot and you're getting mixing of the blood. That doesn't work at all. If it's coarctation of aorta, even then it really doesn't work. If it's transposition of great vessels and you have the aorta coming down, and then it makes sense if you have a patent ductus arteriosus, because that's gonna get blood straight from left ventricle, it's oxygenated blood, it's gonna mix. Because left ventricle is gonna cause another right to left shunt. Due to a defect in NADPH oxidase, cyanosis, single loud S2, and narrow mediastinum on X-ray. This is what I struggle with. Single loud S2 on auscultation and a narrow mediastinum. So what is that? Transposition of great vessels, because a D transposition, aorta will be in front of pulmonary artery, so you only hear the aortic valve closing. Yeah. Okay. This is called as Bell indifference. Severe combined immunodeficiency is characterized by absence CD4, CD19 T cells, basically. Psychogenic pseudosyncope. So next step in management, give them prostaglandin. CD18, LAD on phagocytes. LFA integrin. What is the treatment for severe cases of persistent pulmonary hypertension of newborn? You're gonna have to give NO2. Persistent pulmonary hypertension of newborn is going to cause the differential. One is going to cause a murmur, RVOT. Second thing is that it's going to cause differential cyanosis because it's causing a right to left shunt in somebody who already has a duct coarctation, somebody who has an R2L shunt. Okay, that's viral myocarditis, transposition, ataxia, telangiectasia, all classes would be. Angie doesn't age. A, G, and E, recurrent synoplasm. Systolic, vibratory, musical, heard it, lower mid-sternum. It's a Stills murmur. Ataxia telangiectasia. Presence with ataxia, T cell deficiency, and what else? Ataxia telangiectasia and IgA deficiency. Okay. Absent thymus and tonsil at DiGeorge syndrome. Thymus and tonsils. Absent thymus and tonsils. Why would it not be DiGeorge syndrome? If you have combined. No thymus, no T cell. Oh, that's okay. I'll take a rain check on that. Patients with ataxia have vitiligo, granulomas, high recurrence of what infection? You're gonna have high recurrence of sinopharyngeal. Triad of ataxia telangiectasis, IgA, IgG, and IgE. Findings may be remembered by Prince Edward. Findings of uh, trisomy 18, or otherwise called Edward syndrome. So it's going to be rocker bottom feet, prominent occiput, low set ears. You're going to have a ventricular septal defect, clenched fist on disjunction intellectuals. Okay. Features of chromosome 22 may be remembered as catch 22. Absent thymus and tonsils plus CVI, SCID. Neutrophils filled with staph aureus means it's not destroying it. That's CGD. Continuous is PDA. Why did the PDA murmur display? High recurrence of rhinopharyngitis. Yes, okay, so benign murmurs have the following qualities. They're earlier mid-systolic, they're less than 2, decreases timing of answer. Reassurance because it's benign. Continuous machine-like murmur is PDA, wide, fixed, and split S2. Wide, fixed, and split S2, that's due to an ASD. Yeah, PDA and ASD. So that seems like a continuous murmur that becomes louder at the S2, and S2 is loud as well. That sounds like PDA to me. Why is it louder at S2? It's louder at S2 because aorta contracts, then blood is gushing through the aorta and blood flows through the small opening. Very good. This is going to be CVID. X-linked encapsulated bacteria viruses, enteroviruses. Coxsackie polio echo rhino. Low of all immunoglobulins, recurrence. So that would be CVID in an adult, right? CVID. Cleft palate, abnormal facies, retrognathia. T stands for T stands for lack of thymus. C is for corotruncal abnormal. Truncus arteriosus. H is for hypothalamic. Hypoparathyroidism. SCID involves IL-2 receptor or SCID. Maneuvers that increase, maneuvers that decrease venous return, increases susceptibility to Encapsulated bacteria, viruses. Cyanose that develops after birth and does not correct with oxygen. So, category of diagnosis, probably a PDA dependent. Yeah. So, aorta, so as PDA closes, deoxygenated blood no longer flows from aorta to coronary artery, get oxygenated by the lungs. So, we're assuming that there's a right to left shunt here, a right to left shunt, okay, and then that is gone through the left ventricle, goes into the aorta. So, that's mixed blood. And then that mixed blood is sent through the ductus into the lung circulation, where it gets oxygenated, and then it comes back to the left ventricle as more oxygenated blood. That's why cyanosis develops, and you have a large PSCA, a PDA would help. If you have something like hypoplastic left heart syndrome, then you're gonna have to have a left to right shunt or left to right shunt, which is then going to form a right to left shunt. Total anomalous pulmonary venous connection is when the pulmonary veins drain into the right atrium and then you get mixed blood. In that case, pulm you're not getting any no venous return, no preload to the left heart. So everything goes to the right ventricle, then goes to pulmonary arteries, and then from pulmonary artery to aorta. HIV decreased and in that normal. Hypertrophic cardiomyopathy and consequently heart failure. Bruton's disease. Allergy. By increasing systemic venous resistance. And hypertrophic cardiomyopathy and dilated cardiomyopathy. First line beta blockers, second line pre-doctor. Catley's posture, CGD. Prince Edward, prominent occiput, rocker bottom feet, intellectual disability, non-disjunction, clubbing, and low set ears. LDA1, look, LAD1, sorry. Hypoparathyroidism, lack of tetany, benign murmur is either early or mid-systolic. It's less than 2 grade. Intensity decreases on standing up. Intensity is always low intensity. Grade 1 out of 2, musical vibratory. And dilated. More common in females. Beta blockers and IV fluids. Individuals are DASH disease are susceptible to Candida and Aspergillus colonization. Individuals with CGD, chronic granulomatous disease. Pre-sensitized mast cells. Okay, down for the day. Thank you.